We're done. Okay, I hear we are live. Hello, everybody. My name is Dr. Jennifer Gardella, and I am here with the Executive Director of BCHIP, Kim Everett. Kim, how are you today?
I'm great. Thank you, Jennifer.
So we always have a great topic, and yet somehow we always don't have a list of things we're going to talk about. But today, Kim has a whole list of things because she spent a day out in Harrisburg for, I have it written on a piece of paper, Mont Collaborative CAN Advocacy Day, where she spent the day talking to lawmakers about the importance of mental health, funding for mental health. How'd I do, Kim?
You did fantastic. Look at that. Prepped you well, my friend.
And I know that you had, I'm going to say, a leadership or organizational role in that day. So why don't you just go ahead and talk about who you met with, what you did, and how's it going to go from here?
Absolutely. Happy to do that. So thanks for asking about it. The Mont Collaborative is a really neat organization. It's a nonprofit organization. Similar to BCHIP, it's about collaboration and connecting the folks that are doing some of this work. The Mont Collaborative focuses on the health and human service providers in Bucks and Montgomery County. Kristen DeDominic is their executive director. And their group formed a committee, I guess you would say, called the Community Advocacy Network. So that's the CAN part of this. And it brought together a lot of the nonprofits because as nonprofits, a lot of them know that advocacy and relationships with their legislators is important to their work. But most small nonprofits, very similar to BCHIP, don't really have any resources to be doing any advocacy. Typically, they're not exactly sure what the messages should be. And sometimes, or if they know the messages, they know them from their own perspective. So I don't mean any disrespect to the nonprofits, but and they know them from their own perspective. And then on top of that, they really haven't had any training around advocacy. And so the Mont Collaborative formed this CAN, and the leaders of that, there's committees of the, there are chairs of the committee. But when they met, I guess about a little over a year ago, they brought a lot of the nonprofits together and everybody came in the room and they talked about what they thought the priorities for our community should be. And there were legislators there and they were very engaged and it was a great event. But what we learned is that not only do we need to be able to share what the challenges are with our legislators, we need to give them solutions, right? And we would prefer that they're not always about money, though sadly, a lot of times it does come down to the fact that we need more funding for some of these things that are related to health and human services. So that committee prioritized two main priorities for the year that we just recently worked through. And they were the need for improved support for housing in Bucks and Montgomery County and the need for improved mental health resources. Okay. So I was fortunate enough to be able to kind of lead the work around mental health. And so what was great about this, though, is when we first started, there weren't a lot of folks at the table around mental health. And I was able to really identify some of those key partners, like our friends at NAMI, right? The National Association for Mental Illness in Bucks County. We brought in Family Service Association of Bucks. Jen King joined from the Southeast Council. So we brought a lot more folks to the table that had experience around what the needs were for mental health. And what I love about the work in the end is that we identified 3 priorities for the behavioral health piece that all of us agreed should be the priority. Okay. Because the hope is that if we share the same requests and the same solutions, instead of all of us having different recommendations or different solutions, that we might be more impactful. So the 3 things that came up that we knew we needed to focus on were, of course, the first thing, which I had to laugh, I said, we don't want to make it about money, but the first thing is we need money. We need more financial support for behavioral health. So just base funding for behavioral health services, that funding has not been increased in many years. So yes, increased funding in base services for mental health.
And so when you talk about funding for mental health based services, Where does that money go?
That depends, but typically for our county, it goes to the county and
Okay,
it gives them money to fund the programs that meet the needs of people who are under or uninsured
got
or
it.
address gaps in care. So like possible for residential care, things of that sort. So it goes to the county.
Okay,
So that was the first big request. The second, though, which I don't think folks think of, and we talked a little bit, I think, about healthcare staffing before in our videos, is that we really need increased availability of behavioral health staffing, just like we do physical health. And what's interesting is there are some very specific things that are in the reimbursement rules or in the policy and procedures now that limit people from being able to meet the needs of our patients. So for instance, certified recovery specialists. These are folks with lived experience that are trained and they are helping to respond to people who have substance use disorder. But sadly, their scope of practice is very limited. And so therefore we can't utilize them for all the patients that could benefit from their services. So that requires some changes in the scope of practice for them. And so we're asking our legislators to support some of that.
yeah, and I've also heard that that's a problem for when you say that lived experience. So is it true that, and within all of this, that in order to become one of these counselors, you have had to walk that path yourself?
Correct.
So if you just come off the street and you want to help in that area, you actually can't, or you have to get a different type of degree.
No, you don't, you can, and you
Okay.
don't have to get a degree, but there is training on how to
Ah,
use those skills. And it's pretty comprehensive training
got it.
that is offered. But we know that, yes, if someone has had lived experience and now they feel that they are managing their disease of substance use disorder, and now they want to take that lived experience and share that with people who are still not managing their disease well, they can talk to them in a way and they can relate to them in a way that somebody who hasn't had that lived experience can.
Very, very true. Okay.
Yeah.
I'd recently heard that. I didn't know if it's true or not. And you obviously are the source. So what's the third thing?
The third thing is just mental health parity. And so there's a few things around this that I think are important. One is we need a way to improve transfers of care to behavioral health facilities. So
Oh,
right now, if you're having a heart attack, if the hospital's too full, a physical hospital, they can't say, sorry, we can't take you. We're too busy. We don't have any beds. Turn the ambulance around. You can't come here, right?
sure.
That doesn't happen. They have to accommodate that patient. But our behavioral health hospitals have different requirements. And so if we have somebody sitting in the emergency room that has been identified as being in crisis and they're identified as needing an inpatient behavioral health bed, our behavioral health beds can say, sorry, we aren't able to meet that patient's needs right now. Whether we might not have enough staffing, we might not have the right staffing, we might not have the right bed, we might not have the right location for the patient with that illness. And while I respect our behavioral health providers, I understand there's a lot of challenges there. We have to be looking at that because I just don't think there's parity there when we say, well, the behavioral health facility can say we can't meet their needs. I think we need to be working toward the point that they all can meet the needs. And so I want to support our behavioral health hospitals to do that, right? Like we're
Yeah,
talking about the staffing issue. That's one issue, right? We're talking about funding. So I'm not saying to the behavioral health hospitals, we expect you to do this with your current situation,
sure.
in fairness to them, but long-term goals would be that all patients can go to a behavioral health facility that can meet their needs in a reasonable amount of time,
Right. They
right?
need the funding to have the beds available. They need the staffing, which means people need to be trained. I mean, this is like the
Right.
whole what healthcare is going through right now. There's no one has yet to come up with the solution, but I know that you guys are working on it. So,
No.
okay, you guys went up to Harrisburg, did your thing, talked to people. What's next steps out of this?
So what it was really a fantastic day. We have a lot of support from both sides of our political spectrum. So both our Republicans and Democrats can all agree that housing should be a human right. and I shouldn't say all, but many agree that housing should be a human right and that mental health is a priority for our community. So we're fortunate in that I think those things are pretty glaring and it's really hard for anybody to ignore them. Exactly how to fund all those solutions is certainly a little bit more challenging. But the day itself was great, and we were very well received by those that we chatted with. And we did do a press event on the steps of the Capitol, which that was really exciting and fun to do. That's not something I've ever done before. So that was exciting, a really good opportunity. As far as what's next steps is it's continuing this work. So we're bringing the CAN back together actually this week to say, what do we do next? And I believe that will be continuing these visits with our local legislators while they're, we don't have to go to Harrisburg. They're here in our communities. While I love the power of the connectiveness and, the power in numbers and having that, visibility, I think is important. Now it's time to bring it back to the local level and continue to meet with our local legislators and to continue to focus on these priorities that were identified. And I think it's really important to not every nonprofit is aware of the Bucksmont Collaborative and not every nonprofit is aware of these priorities. So I think trying to really focus on getting that word out to all of our nonprofit partners, and not just nonprofit partners, but all of our behavioral health or housing partners to say, look, if you agree that these three things are the priorities for these two issues, we need to all be speaking the same language. And so when they're visiting, because a lot of people do advocacy, we want to keep using the same language. And I think that will be our next steps.
Right, that's great, because so many, especially I know the Doylestown, Buckingham area the best, but so many that worked in mental health nonprofits, they are opening up their own practices because there's so much need there. But when you go into a private pay situation, it's $175 an hour. And who can afford that? It's really, and it's excluding a group of people, I think, that really need the support.
It's sad to me because I think we're starting to make some progress around equitable healthcare. I mean, we're not there by any means, but it's certainly where we know we need to go. But I think we keep ignoring the behavioral health piece in that equation. And I think it's just that gap keeps getting wider to me from those that can and are privileged enough to have the funding and support to those that cannot. And so that is concerning to me for sure. And
you've always been such a huge proponent of, we need to strengthen the conversation around it's not that bad to go and get yourself some mental health help, right? Like we need to change that language to say, okay, if you need assistance, it's confidential, it's almost anonymous, no one has to know, and your whole life can turn around in a couple sessions if you just get the help that you need. I'm a huge fan of
no, I'm really an
seeking out
advocate for
mental
that.
health when you need it. So because
I think everybody should go. If anyone says they don't need to see a therapist, I think they're kidding themselves. I think everybody should go. I think you should go like you do get your physical. If you get your physical every year, you should go see a therapist at least once a year and check in. And this is how I'm feeling, and this is what was new, or this is how I handled it, or this is how I wished I would have handled it. I don't know. I'm really an advocate that we have to start thinking that our mental health is just as important as our physical health. We need to give it as much attention. So, everyone, we're all keen on eating healthy and exercising and, making sure that you're doing all you can for your physical health a lot of times, but do people really do what they need to do for their mental health? And I think people are leery to use medication. And while I don't think medication is the only solution by any means, I think therapy and learning skills and those kind of things are important. But for people who need medication, the resistance to take it is really frustrating to me. I've experienced that in my own family and friends, and people are like, I don't want medication. Well, if you're getting all these physical symptoms because of your emotional health, why are we not using the medication for emotional health to manage those symptoms? So I do think medication is an option at times for some folks. But I find people so leery to take it. So I think that's interesting too.
Yeah, and as I always tell people, you don't sign up for forever.
Right. Right.
You can be on something for a little bit of time. You can be in therapy. Heck, you can call, you've introduced me to the world of 988.
Mhm.
which is a simple number that anybody who's listening or anyone can call and get the help that they need. That's completely confidential and anonymous. And you can even just text hashtag 988 if you're more of a texter and get them, get support. So there's plenty of places available. And there is a lot of research coming out right now that says that your mental health is just as important as your physical health. So
Absolutely. And while I believe in personal connections more, we do, thanks to COVID, if you really don't want to go somewhere or you really can't go somewhere, there's telehealth resources too, right? So we've even kind of eliminated that barrier.
yeah,
So
there were so many barriers before, and now there's so many great resources out there. So people, if you're listening, use them.
yeah, absolutely. And 988 is absolutely the number we want to recommend for all to call. They have a wealth of information to share and can provide direction for people who are just saying, hey, maybe a friend of mine seemed a little sad, to somebody who's in absolute crisis. So they have resources across the spectrum.
Okay, well, Kim, thank you for doing all that work for the Bucks County, Greater Bucks County community and your Advocacy Day and sharing it with us out in Harrisburg, of what you experienced out in Harrisburg. And we look forward to hearing updates from you in the future.
Absolutely. I will keep you posted. Thank you.
Bye.